Greetings. My name is George Gilkoff, and I'm an applicant for the lecturer position. I'd like to begin by thanking the panel for the opportunity to share my interpretation of domain number 5 of the APHRA Professional Capabilities for Registered Paramedics 2021. I'm being asked how I would incorporate domain 5 into teaching contemporary undergraduate paramedic science. Before I begin, I want to acknowledge that in paramedic practice, the competent clinician will demonstrate proficiencies from several domains concurrently with the goal of treating the patient holistically. The first element, which is to use patient information management systems appropriately. In the face-to-face presentation or the online component of the unit, we would define the rationale and the medical value and the use of health records from a historical perspective as a foundation. Then we would look at how the medical record represents an accurate, comprehensive, and logical record of the patient's health history. Another element would be the functional aspect. Medical records, for it to work, needs to be contained in an accessible and retrievable form and needs to be systematized, and it is. This system also attracts confidentiality and privacy legislative requirements for all health records because of its highly personal nature, so it's protected information. The system has been evolving. The migration from paper-based to electronic-based record keeping in Australia has been going on for the last decade, and we're almost there. Next, moving on to pre-hospital care. We need to understand the anatomy of the pre-hospital care report form as a medical record and a data collecting tool, and this needs to be unpacked for the student. After that's all done, we will then progress to utilizing pre-hospital care report forms during case-based teaching scenarios as a first opportunity for them to begin recording information and data. And then, of course, we will continue on to utilizing pre-hospital care report forms during clinical placements. Moving on to element number 2. Assess and monitor the patient's capacity to receive care. In the face-to-face presentation or on the online component of the unit, importance of assessing the patient's alertness and orientation, APHRA, in the primary assessment will be covered. Significance of conducting physical assessment, diagnostic evaluation, history taking, formulating a presumptive diagnosis in collaboration with the patient will be emphasized. This way, the patient feels like they're involved in the process, which is important in gaining trust. The practitioner will convey knowledge and information to ensure the patient gains trust and confidence in the process, in the system, and the practitioner. The clinician will also identify and manage communication barriers that the patient may be experiencing and attempt to resolve them. The clinician will be encouraged to share the genuine concern regarding the state of the patient's health, to be as sincere and truthful as possible. Moving on to the practical element, we'll be utilizing problem-based learning and case-based teaching scenarios with patients of questionable capacities in order to work out strategies to deal with them. And finally, utilizing assessment and monitoring of patient capacity skills in clinical placements. Moving on to element number 3, understanding the key concepts of bodies of knowledge which are specifically relevant to the paramedicine practice. In the face-to-face presentation or online, we will undertake the study of human anatomy and physiology, pathophysiology, knowledge of health, human growth and development, disease, disorder, and function. We will also participate in the basic mechanics of scientific inquiry and research, conduct comparative analysis of pre-hospital treatment efficacies in order to develop that skill set to evaluate what the current therapies are in pre-hospital care. We will also learn the assessment strategies from established practices in clinical pre-hospital science in order to establish a working diagnosis and a patient management methodologies within legally mandated CPGs. On the practical side, we will participate in tabletop case-based learning scenarios, followed by engaging in high-fidelity simulation of case management scenarios that are CPG-driven. And we conclude our trajectory by partaking in clinical placements where application of clinical knowledge, reasoning, practical clinical skills in an acute pre-hospital care environment are done under supervision. Moving on to the fourth element, conduct appropriate diagnostic or monitoring procedures, treatments, therapy, or other actions safely. In the face-to-face presentation or online, we will address and institute methodology for continuous scene assessment and situational awareness when dealing with pre-hospital emergencies. We will develop a working diagnosis based on collecting data from the chief complaint, primary assessment, history of presented illness, past medical history, vital signs and diagnostic signs, cardiopulmonary assessment, and other assessments pertinent to the case. So in order to achieve a working diagnosis, we have a lot of data to collect. We will treat the patient safely based on evidence discovered in the assessment against the knowledge of clinical pathophysiology, contemporary evidence-based treatment, and clinical practice guidelines. So when we integrate all that information, we'll be able to treat the patient efficaciously and safely. On the practical side of the house, in the same topic, we will participate in tabletop case-based learning scenarios to develop discrimination in similar and confounding presentations in order to differentiate complex cases. Application of critical thinking and clinical judgment skills in order to safely arrive at a working diagnosis and a treatment plan. We will then move on to engaging in high fidelity simulation of case management scenarios that are CPG driven, where knowledge and performance evidence may be practiced and demonstrated. And finally, we'll participate in clinical placements where application of clinical knowledge, reasoning, and practical skills in an acute pre-hospital care environment under supervision. Moving on to element number 5. Demonstrate the requisite knowledge and skills to participate in mass casualty or major incident situations. In the face-to-face presentation or online, we endeavor to review historical cases of major disaster. For example, 9/11, Fukushima meltdown, the 2017 Burke Street, Melbourne attack, Cyclone Debbie, the 2019-20 bushfires, and the COVID pandemic. We will review these cases from a historical perspective in order to learn what went well and what went wrong. In addition, we will disseminate pre-hospital mass casualty incident management concepts and practices that are currently used in Australia. We will endeavor to conduct the AIMS course, the Australian Inter-Service Incident Management System. This is the current best practice with regards to interagency networking and working together in the event of a serious incident. We will also make sure that we cover ethane, which is the acronym for SITREPs that are used universally in pre-hospital emergency medicine in Australia. We will cover mass casualty incident primary and secondary triage principles and methods, mass casualty incident scene layout for incident management. And by the time we arrive at our practical practice, we'll conduct primary and secondary triage and clinical decision-making exercises before we move on to conducted simulated major disaster exercises involving first responding unit, commanders, clinician, and subsequent units that follow. After that, we will elevate our practice to participate in an interagency major disaster exercise. Crash fire at the airport or a building collapse with the fire service, for example. And then we will cover stand down and hot debriefing procedures. And moving on to element number 6, and where we formulate specific and appropriate patient care and treatment actions. In the face-to-face presentation or the online component, we will address the fact that since every person and their problem situation is different, optimizing appropriate, culturally safe and suitable treatment is warranted. We will address that by learning about the socially diverse populace with different physical, psychological, environmental, cultural, and socioeconomic and system prejudices that have factored into their human journey, we are armed with the rationale as to why pre-hospital care delivery needs to be respectful and contextualized to the individual patient. Awareness of the power differential held by government agents, 000 paramedics versus the general population compels us to judiciously optimize the delivery of care, health, and safety outcomes appropriate for the patient. Moving on to performance knowledge, we will participate in tabletop case-based learning scenarios to develop knowledge, reasoning, and problem-solving skills to cultivate appropriate and contextualized treatment plans. Engage in high-fidelity simulation of case management scenarios that are CPG driven, that include diverse populations with special needs, to work out strategies of how to manage these types of patients before we go outside and engage in our clinical placements. Now, when engaging in clinical placements, where the application of clinical knowledge, reasoning, and practical skills in an acute pre-hospital care environment with diverse populations and special needs under supervision is done. Well, that wraps it up for me. I'd like to thank the panel for the opportunity to share my interpretation of domain number 5 of the APHRA Professional Capabilities for Registered Paramedics 2021 edition. Thank you.